Have you thought about doing a brow lift, but you weren't sure because of not knowing the pros and cons of doing so? I'm Dr. Dominic Castellano at Elite Facial Plastic Surgery, and I'm going to talk to you today about brow lift pros and cons. In particular, I'm going to talk to you about doing a brow lift that's up in the hairline. Now, the benefit of this is that you are directly elevating the skin to elevate the brows. Now, the nice part about that is that it helps to reduce a forehead that is too high. And by elevating the brow, you have to essentially elevate the skin off the muscle. And that's another pro of the procedure, because you are separating the skin from the muscle, and that helps remove those lines that you've developed over time in the forehead. And as you work your way down into the lower part of the forehead, you're able to release some of the attachments to what we call the orbital rim to really elevate the brow and open up the eyelid complex. All too often, patients focus on their eyes as being the culprit, and in actuality, it could just be the brow. But in most times, it's a combination of the brow as well as the upper lids. Because as we age, not only do we have descent of the tissues, but there's also some stretching as the tissues become more elastic. So if you just focus on addressing the upper lid skin and you don't address the brow, you're still going to have that hooded or tired appearance. Now, with this procedure, you are going to have some numbness, which is very common. And whenever you do facial plastic surgery procedures, you're going to have some numbness. Normally, most patients have some persistent numbness, maybe up where the incision is up here, but over time that will improve. Now, the other approach that patients have often inquired about is what we would call the coronal lift, that be intermixed with like a full facelift, where the incision will go all the way up here. But with the brow lift I'm talking about is it's hidden up in the hairline. And the way the incision is designed is that it's beveled, so that way when your hair grows, it will grow through that incision and ultimately will not be visible. Other thing that I want to mention to patients is they worry about not only sensory nerves, but motor nerves, which elevate the brow and the eyes and so forth. Those nerves should not be affected by the brow lift that I'm talking to you about, because those nerves are deeper down and are not going to be affected by the procedure. Now, patients can have a little bit of weakness related to swelling, but over time, that should go away. Now, with the brow lift that I'm talking to you about, the long-term results are going to be, essentially, for the rest of your days or the rest of your life. Now, it's not going to stop the aging process, obviously, but it certainly complements doing an upper lid blepharoplasty to open up this what we call the upper periorbital area. As always, if you have any questions or comments, put them in the comments section or give us a call. We're always available. The worst, it's going to cost you some time. Take care.